Staying on the parent side of the house, we'll move to the parent portal with Stephanie.
Wonderful. Thank you, Jennifer. It's wonderful to be here presenting to everyone today. As a reminder, I showcased this slide at our last implementation update, but just want to make sure I'm orienting everyone to our legislative responsibilities around what it is that we're delivering. So we are part of House Bill 1800, in which it states that we are to design and implement a parent portal to connect families to service and education infrastructure related to behavioral health services for children ages 0 to 17. Part of our work expands beyond a bit of the scope of just what's called out in House Bill 1800. And I'll also point out in that we're helping to service children ages 0 to 25. So the intent is to really help children and youth through that transition phases of learning more independence and helping to be kind of on their own, and what that means when you are carrying some behavioral health diagnoses with you. The other point I want to call out before I move on is that we have transitioned the name from a parent portal to now we are calling it BH360, which stands for Behavioral Health 360. And what you're seeing on this screen is some screenshots of the prototype of the website that we have up and available for anyone who wants to go take a look. You can go on to the next slide. This slide highlights how we're thinking about the site being able to help families in a tiered fashion. And so the intent is to be able to help families no matter where they are on their behavioral health wellness journey with their child. The idea is for some families, when you're at different phases, the types of resources that you need access to will change. And so inherently what we're trying to do is make sure that we have a breadth of resources and information to help support you no matter where you are. So for those who are earlier on their journey, and I recognize that this is a bit of an oversimplification of what the journey can actually feel like to a caregiver, but when you're earlier on in your journey and you're noticing some challenging or concerning behaviors, you can go on to BH360 and answer some screening questions about those behaviors that you're observing. And based on those answers you provide, we will give you some personalized information regarding psychoeducation, parent help, some toolkits about some potential diagnoses that you might be challenged with, that your child might be challenged with, as well as connection to local community-based, culturally competent resources. I'm going to talk a lot about that more today. If you are a little bit further on your journey, so perhaps you already have a diagnosis for your child, this is a way to come on to the site and to continue to access some of that personalized information, find more local resources in your area, as well as begin to connect with other families who have lived experience that can help shed perspective on what their journey was like to help you with yours. And then lastly, one of the things that we want to make sure we have access to for families is the ability to navigate your legal rights and understand what kind of supports you have inherently in the system and how to navigate the system. Because when you have more complex challenges, or you've been on this journey for a long time, there's going to be a need to understand how all the things connect and what types of ways you can help advocate for yourself and for your family. You can go to the next slide. This slide here just shows a little bit more tangibly what a family can expect when they come onto BH360. This is the types of resources and information that we'll be connecting you with. And again, you'll get that personalized aspect because you'll be answering screening questions for those that do. You don't have to answer screening questions to access all of this information. The screening questions just help us narrow what kind of information will be most impactful or relevant for your situation. You'll have access to parent psychoeducational information as well as children's psychoeducational information, school resources, community resources that are both youth-focused and parent-focused, and of course, behavioral health providers in your area. If you go to the next slide, what I'll show is what it might look like in an example use case. And this is just an example that is completely made up. So don't take any of this in terms of the content, but the concepts are what you should be grasping from this. So this is an example of a 12-year-old boy. He is male, cisgender, his family is Micronesian, and his family are immigrants. They're actually refugees that came to the US in 2015. They live in Kent, and we've gathered this information from things that they have told us when they signed up for the site, as well as information that they provided in the screening questions. And so what we're seeing is that he's failing his classes except for science, where he loves his teacher. He's being bullied in school, and he's getting in fights with some of his peers. And the other aspect that we're seeing as well is based on the answers provided, the mother has indicated some food scarcity concerns. So what you see here in the gray is all information that was provided either through registering for a profile in which you'll give us some high-level demographic information about yourself, as well as what we're seeing in the question, in the answers that were provided to our screening questions. What you're seeing in the yellow is then how BH360 will help connect you to impactful information that can help support you on your journey. So the next slide, if Jennifer, you want to move on one more, will show what you would receive back as the caregiver once you have completed the screening questions. And so this is an example of what you'd be provided that can be printed out, and you could actually walk away with this and begin to access some of the meaningful resources that we have on our site. You'll have caregiver resources in the area, again, some food resources because you indicated that food scarcity might be a challenge, providers in your area, and school resources. So here are the resources that we found most relevant given the answers to the screening questions and what we were able to garner from the information provided by the family. The idea is that even families who don't have access to a smartphone or a computer could go into a library and access BH360 and then walk away with a printout that can help them on their way. If you go to the next slide, I'll talk a little bit about where we are on our journey in developing the site. So we have a prototype developed, and we are continuing to showcase that prototype and evangelize some of the work. We are looking for some additional private funding to help support the full development of the site, which will take roughly 10 months from the time that we formally kick it off to get that started or to get that completed. The other thing that we are thinking about doing in the intervening time is doing an intermediary pilot where we can start to evaluate the efficacy of the platform in some underserved communities. Our focus first and foremost is to help those in the communities who are furthest from reach, but most in need. And so we're going to try and figure out the most effective ways to do so. And then I think I have one last slide, which is about asking for participation. So as we think about those local in-community resources that can help families more immediately, there are lots out there and lots difficult to find, but we want to gather as much information as we can about some of them. And so we would welcome those attending today in participating in some of our surveys to collect information about them. We're collecting both quantitative and qualitative information so that we can start to reach out and connect with some of those resources and make sure that we can categorize them appropriately so that as families participate in our site, we're providing those that are most relevant given their particular needs. And that's all I have. So thank you all.
Thank you, Stephanie. It's an exciting journey. It's good to see where you guys are headed.